Now, the Scottish Parliament is being urged to improve testing and treatment for Lyme disease. It's a bacterial infection and it's more common in Scotland, apparently, than any other part of the UK. While it's difficult to put an official figure on the total number of British cases, it's estimated that there are 2,000 to 3,000 new cases in England and Wales each year. Lucy Smith was diagnosed in 2016, but she'd been suffering from the symptoms for years.
I started having problems with my vision and had a vomiting virus in my second year of university. At the time, I was given antibiotics to stop the vomiting, but there was no further investigation in terms of what was actually causing me to have this virus, and particularly the changes to my vision, which were obviously quite disturbing and unusual. And then I did slowly sort of get better, or to a point where I could work and study and train to become a counsellor when I started to become ill again with more extreme symptoms, pins and needles, more extreme fatigue, dizziness and additional visual problems as well, and also pain in the joints, which is also another common sign of Lyme disease. Again, I did go back to the doctors at that time. Nothing like Lyme disease was ever mentioned. It wasn't even part of the discussion then. That was in 2012 and then again in 2013. And then I had another relapse in 2014. At that time, we really felt like we had to get to the bottom of what was going on, and I started seeing somebody in Manchester for ME, who then suggested that it might be good if I got tested for Lyme disease. So then I got tested abroad in Germany, and that came back positive, as well as other co-infections, which is very common, and it was the European strain of Borrelia. The test, the Western blot that they use here, is a very blunt tool. It doesn't diagnose people who've had it for more than maybe a few months in some cases, and if you use it too early, it's not effective, and you just need to invest time and resources, which I know is difficult for the NHS. But the sooner people get diagnosed with it, the less cost it is for everybody.
Lucy Smith talking there about symptoms. Well, Sandra Pearson is the medical director of the charity Lyme Disease Action. What it sounds as if this is in a way quite a confusing disease. I mean, in literally words of one syllable, can you just explain what Lyme disease is? What do we know?
Yeah, I mean, you're right, Peter. It is a huge and complex subject, and I've got little time. We know that it's a bacterial disease transmitted by the bite of an infected tick. Ticks are like small spiders. Ticks prefer damp, humid conditions, so that's perhaps one of the reasons it's more prevalent in Scotland and the southern counties. And Lucy's absolutely right. With increased awareness, if it's caught early and treated early with antibiotics, there's a much better outcome than if it's left to become persistent.
So what are people asking? For example, this approach to the Scottish Parliament, what do people think they need?
I think what they're saying is that they would like better diagnostics, better medical expertise, improved testing, and a recognition also that this isn't a simple bacterial infection once it gets into the system, that it's actually complex, and there's an emerging body of science behind this at the moment that seems to be being either dismissed or ignored, which is absolutely fascinating. But they're basically asking for improvement, and I think what Lyme Disease Action as a charity would like to see is more research. Lyme disease, especially late Lyme, as Lucy is describing, has been vastly under-researched.
You see, what's puzzling to someone is why should, like Lucy, actually be able to be diagnosed in Germany? Science is shared now, presumably. Yeah. Indeed, that's what a lot of the debates about the EU are about. Don't we know what's happening elsewhere in the world?
What we do know, that the current tests that are used to diagnose Lyme disease, called serology tests, are indirect tests of antibodies, and they actually have limitations. There was a large scientific study published last year by the European Centre for Disease disease control, which showed a mean figure of 77% accuracy for neurological Lyme disease, 73% for other late Lyme disease, but these tests are being used outside that as if they are ideal or a gold standard, and they're not.
Right.
So patients searching to try, who may have been dismissed, who may actually have a good story of tick exposure, rash, neurological symptoms, desperately searching to make sense and receive, get their lives back, obviously look to any source of help and send bloods abroad. Germany does, again, serology tests, which have limitations. And it is very difficult and complex area, but basically we do need better tests, and there's a lot of research going on internationally.
I'll have to stop you there, Sandra, but thank you very much. Sandra Pearson, and new draft guidelines on Lyme disease are being published by NICE in 10 days' time.